Vomiting on Wegovy or Zepbound can be expected, but it should never be dismissed automatically. One episode after starting or increasing a dose may settle with smaller meals and steady fluids. Repeated vomiting, severe abdominal pain, or an inability to keep liquids down needs faster action. Recognizing the pattern can protect your kidneys by showing how quickly to act. Wegovy contains Semaglutide and Zepbound contains Tirzepatide. Both reduce appetite and slow how quickly food leaves the stomach. Food then remains longer, so fullness lasts longer. A large or fatty meal can overfill a stomach that is emptying more slowly. That pressure can turn nausea into vomiting. That pattern is most common after treatment begins, after a dose increase, or after eating beyond the new fullness point. One brief episode can fit an expected adjustment. It should then ease, and you should still be able to drink, urinate, and function normally. Expected does not mean harmless in every case. A medicine should not repeatedly stop you from drinking, sleeping, eating, or taking important tablets. Vomiting that returns after each injection deserves a review of the dose, even when it eventually stops. Many people think stronger sickness means stronger weight loss, but it does not. These medicines work by reducing appetite and food intake over time. Losing meals through vomiting is not the intended mechanism. More vomiting may instead mean the dose is too high, the meal was too large, or the increase came too quickly. One person increases the dose, eats a heavy dinner, vomits once, then keeps water down. Another vomits every few hours, feels dizzy, and urinates much less. Both use the same type of medicine, but only one pattern is settling. For the milder pattern, pause solid food briefly and let the stomach settle. Take small sips instead of drinking a full glass quickly. When liquids stay down, restart with a small bland meal. Avoid fatty foods, alcohol, and another large portion that day. Small sips still need to add up. An oral rehydration drink can replace water and salts after repeated losses. Very sugary drinks may worsen nausea for some people. Do not force food while actively vomiting. Fluids come first, then small amounts of easy food after vomiting stops. Vomiting also does not remove the injected dose from your body. Do not repeat the weekly shot. An extra dose can intensify symptoms. If an important oral medicine came back up, ask a clinician or pharmacist before repeating it. Your body may already have absorbed part of that oral dose. There is no single safe number of episodes for everyone. Direction matters more than count. An isolated episode should settle, while repeated episodes should not keep intensifying. Symptoms lasting into the next day or returning after each dose need medical review. Improvement after small sips is reassuring, while worsening despite them is not. A dangerous complication can begin with only one episode. Waiting for vomiting to become dramatic can waste important time. One episode with severe pain may be more urgent than several episodes without pain. Severe upper abdominal pain that does not ease may signal pancreatitis, meaning inflammation of the pancreas. The pain may spread into the back and feel deeper and more constant than ordinary stomach discomfort. Vomiting can occur, but persistent pain makes the situation urgent. Pain under the right ribs can point toward a gallbladder problem. Fever, yellow skin, or pale stools make that concern stronger. Rapid weight loss can also raise gallstone risk. These symptoms are not a routine adjustment and need prompt medical assessment. Repeated vomiting creates another danger even without severe pain. Fluid leaves faster than it can be replaced. Blood pressure may fall, kidney blood flow may drop, and weakness may grow. The risk is greater in older adults, people with kidney disease, and those taking water pills. If you're older, watch hydration closely. Dark urine, much less urine, a dry mouth, racing heartbeat, or dizziness when standing can signal meaningful fluid loss. Fainting, confusion, severe weakness, or almost no urine suggests a more serious problem. Hydration comes first, but timing can also help identify the cause. Vomiting soon after a dose increase suggests your body is not tolerating that dose well. Vomiting with fever, diarrhea, or sick family members may point toward an infection or contaminated food. That helps determine whether the dose or a separate illness needs attention. The expected slowing becomes concerning when even a small meal seems to remain for many hours. You may feel unusually full, bloated, or sick long after eating. Vomiting may contain food eaten much earlier. That pattern needs review by the clinician who prescribed your medicine. What matters is whether fluids stay down, you keep urinating normally, you can stand without dizziness, and severe pain is absent. Those 4 checks are more useful than asking whether vomiting appears on a side effect list. A common side effect can still become dangerous when dehydration or strong pain appears. Anti-nausea medicine may reduce vomiting while those warning signs persist. It cannot correct dehydration, pancreatitis, or a blockage. Vomiting can create another problem when it sharply reduces how much you eat. Diabetes treatment becomes harder to manage. If you use insulin or a sulfonylurea, a medicine that increases insulin release, eating much less can lower blood sugar. Check glucose more often during significant vomiting. Sweating, shaking, confusion, or unusual sleepiness needs immediate attention. High blood sugar also matters during illness. Persistent vomiting with deep breathing or marked drowsiness needs urgent assessment, especially when glucose is very high. These signs can signal a dangerous acid buildup in the blood. Do not assume every symptom comes from the weight loss injection. Seek emergency care for severe or persistent abdominal pain, fainting, confusion, trouble breathing, or blood in the vomit. Green vomit, a swollen, painful abdomen, or inability to pass stool or gas also needs urgent evaluation. Those findings can suggest bleeding, blockage, or another serious condition. Without emergency signs, contact your clinician that day if vomiting keeps returning. Contact them if liquids are difficult to retain or urine output is falling. Call before the next dose if symptoms remain significant. The plan may involve delaying an increase or returning to a tolerated dose. Kidney function may need testing while another cause is investigated. Do not repeat the same dose and meal pattern while hoping your body eventually gives in. Record the injection date, dose, meals, vomiting times, pain location, urine changes, and glucose readings. That timeline can help show whether the dose is too strong. It can also suggest food poisoning, infection, gallbladder disease, pancreatitis, or low blood sugar. After current symptoms settle, prevention starts with meal size. Eat slowly and stop at the first clear fullness signal. Heavy fried meals remain in the stomach longer and commonly intensify nausea, especially after dose increases. Avoid lying flat immediately after eating. Drink regularly through the day instead of trying to catch up after symptoms begin. Dose increases are not a race, and moving upward during active nausea can trigger repeated vomiting. Tell your clinician how the medicine affects normal life. A lower tolerated dose is more useful than a higher dose that repeatedly interrupts treatment. Vomiting after Wegovy or Zepbound is often understandable after starting, increasing the dose, or overeating past fullness. The response depends on hydration and warning symptoms. Keep fluids down, watch urine and dizziness, and act quickly for severe pain or repeated vomiting. Sickness is not proof of success. Medicine simplified. That's what this channel does. If you want more, hit subscribe. This is not medical advice. Consult your doctor.